Is your provider recommending something called a biophysical profile and you're wondering what the heck that even is? We're going to be breaking that down in this video. I'm Roxanne, I'm a labor and delivery nurse and student midwife, and I'm going to be breaking down what exactly is a biophysical profile. This is one of the tests that your provider can do at any point during your pregnancy to check on the well-being of baby. It involves 5 different things. The entire test can take between 30 minutes at a minimum up to 70 minutes, depending on all of the different tests that they're doing within. And this, again, is checking on the well-being of baby. How well is baby doing in this moment? And how likely is baby going to potentially go into distress in the next couple of days? For the full test, this can take up to 70 minutes, and this is scored out of 10 points. It involves 5 different things. The first one is going to be a non-stress test, and this is usually done last after the ultrasound part because this is where they're going to place you on a fetal heart rate monitor where the top is going to be like a contraction monitor and the bottom one is going to be measuring baby's heart rate, and they're going to watch baby's heart rate for 20 to 40 minutes. And that, again, is either done at the end and sometimes it's even omitted. The second test is they're going to be looking at baby on the ultrasound for 4 different things. The first one, they're going to look for how much amniotic fluid is inside of the uterus. So they're going to do what's called an AFI, or amniotic fluid index. And they can do this 2 different ways. They can do it by looking at all of the 4 different quadrants of your belly and adding all of that together for the greatest amount of amniotic fluid volume. And we ideally want this number to be between 5 and 25. Or the other option is what's called a single greatest pocket or single deepest pocket. And this is where they're just going to look around the entire belly to find the biggest pocket of amniotic fluid that they could find. And then this ideally needs to be above 2. The other things they're looking for are fetal movements with baby. So they're looking for gross fetal movements, and then they're going to look for fine movements, which assesses for fetal tone. So for the gross movements, it's like them opening and closing their arms, moving their head, rolling around potentially within the uterus. And then the fine movements are more like opening their mouths, opening and closing their fists. And these are like those smaller movements. And we want to see a few of those movements. And then the last one, which usually takes the longest amount of time to see, is breathing movements. So baby is practicing breathing while they're still within the womb. So we're looking for that movement of them breathing within the womb to count towards this test. So if they include that non-stress test within the biophysical profile, again, the points are out of 10. But if they exclude the NST or the non-stress test from that exam, because maybe they don't have the capabilities to do the non-stress test, then it is only out of 8 points. And you can't get partial credit for any of these things. It's either 0 points or you get 2 points. If they include the NST, they can get a 10 out of 10 for everything, and that is an indicator the baby is doing well. You can even get an 8 out of 10, and that is an indicator that baby is still likely doing well because, again, sometimes that breathing movement is the one that they won't have. If it's a 6 out of 10, this is a sign that they need to look further, figure out what's happening exactly with baby, ideally probably retest in 24 to 48 hours. If it is below 6, this is an indicator that baby potentially is showing signs that they're not doing well, and an induction or moving towards delivery is a recommendation. The one thing with the biophysical profile is you could still get an 8 out of 10 on this exam and still have that recommendation for induction based off the amniotic fluid volume. If that amniotic fluid volume is less than the recommendation, so either 5 if they did all 4 quadrants or less than 2 if they just did the single greatest pocket, this is a reason that they would recommend induction because that amniotic fluid volume is one indicator that maybe baby needs to be born sooner rather than later because that's their cushion, but it's also that level is a sign of how well baby is doing in the womb as well. So if that amniotic fluid volume is too low, they will likely recommend induction even if baby has all of those other things because there's an increased risk of baby having an accidental cord injury or doing some sort of damage potentially to themselves because they're not able to move as easily with the womb if that amniotic fluid volume is low. The biophysical profile test is normally recommended at the end of pregnancy, or if you are higher risk, they'll do it a little bit earlier throughout your pregnancy. It's also done anytime you come into the hospital for decreased fetal movement because we always want to check in on the well-being of baby for decreased fetal movement. So just to recap, the biophysical profile is an exam that's done anytime they want to check in on the well-being of babies. So it could be done if you're high risk, if you're having any decreased fetal movement, or if you're past your due date. And then this involves 5 different things. 1, the non-stress test, and then an ultrasound that's looking for the amniotic fluid volume, baby's fetal movements, so gross movements as well as fine movements, as well as breathing movements. And all of this give us a great picture of how well baby is doing to whether we can continue pregnancy or if we need to move towards delivery. If you had a biophysical profile done during your pregnancy, let us know in the comments below how your experience was. If you enjoy this video and you want to learn more from us, please subscribe to our channel so you can be notified whenever we release new videos. We try to release 2 educational videos a week and 1 workout video. And if you're pregnant and looking for more support, check out our online childbirth education program where we break down the science of labor and birth to make it less mysterious and scary as you navigate it. We also have a prenatal fitness program to help support your body throughout pregnancy so you can be able to move during labor as well as has a pain-free pregnancy. And you can check out all of our offerings on our website and use code YouTube10 to get 10% off any of our offerings and our bundles. Our bundles are already discounted 15% off. So if you use our YouTube10 discount code, it's like 25% off, which is like basically free at that point. And you can again check out all of our offerings at MamasteFit.com.